Tiersky. Thank you for having the opportunity for me to be able to speak with you. This is a conversation today to be able to help to support the members of the Chicago Dental Society, and it gives you a chance, as an opportunity. We're all in very unusual, uncharted waters for many of us. Um, And this is an opportunity to hear from the leadership of the CDS and to hear what your thoughts are. And as we have this relatively brief conversation, if you ask me any questions, I can try to answer too. It's a bridge between the practice community and education, and I want to thank you for the opportunity to have this conversation.
Well, good morning, Dean Stanford, and I really appreciate having this opportunity to have this discussion with you and the time to just chat. And this has been an interesting time for all of us. I use the word interesting lightly. It's I could use a lot of different words, but it's been a challenging time, and I think I welcome this opportunity to have this discussion with you, and I thank you.
Sure. In times of unusual issues, it's always good that communication, there's an old joke in leadership that you can never over communicate. And sometimes we're communicating in a little bit of the fog of war and we don't know exactly where we're heading. But I think it's very helpful for especially members to understand what are the thoughts that are going through the leadership and what the leadership is considering. So I thought maybe we could start here as to if you could give me any sort of thoughts of what the CDS board is thinking about through this, and especially the fact that CDS really represents the best in terms of continuing education. What has been the board's thoughts around this new world about either the large meetings and the future of the large meetings and the value those have, because they are incredibly important for networking and being able to bridge that professionalism between us and to share information. But how is that going to bridge to with the advent of so much online learning that's going on in the CE space now? Mm-hmm. And your thoughts on that?
Well, first of all, I couldn't agree more. I think at a time like this, communication is vitally important, and we're all communicating a little bit differently right now. All of our meetings have been held by Zoom. The CDS board has been meeting via Zoom like everyone else. And I want to first say that we have been trying to communicate to our members. When this all started initially, we reached out to them just to try and offer words of comfort to hang in there. We reached out to our members right at the beginning of this pandemic, and our members stepped up. I'm very proud to say our members stepped up with their donations of PPE right at the beginning of this fight. And so I did want to mention that through this new form of communication, we were able to pull together and have our members really step up. But as far as to your point of continuing education, we are definitely looking into that as we see that the future of large meetings like our midwinter meeting, we don't know what's going to happen. So this Thursday, we are sponsoring a webinar specifically for Illinois residents on the COVID-19, how it's affecting the business aspect of their practices. So right off the bat, we are offering that on this Thursday rather, the 30th at 2 o'clock, and people can sign up on our website, cds.org. But going forward, our regional meetings that we hold, are large gatherings, and they're very important to our members to get CE. So we are in discussions, at the beginning of our discussions, about the future of those and whether we will have to hold those via a Zoom type format. As far as large gatherings like our midwinter meeting, we are just beginning to wrap our heads around what the future may hold for a meeting like that. As I'm sure you know, most of the large dental meetings for the rest of the year were canceled. We were very blessed to have been able to hold ours. But what the future holds, we don't know right now, but we are starting to think about what these meetings might look like, and it's possibly going to be a different venue. different
Well,
venture.
well, you have me on your program for 21, so maybe I need to start thinking about my lecture a little bit different.
Well, maybe not quite yet, but perhaps in the back of your mind, you might need to, to start thinking about it. I think that everyone's going to have to start considering this, given the present. But I think it's certainly something we can't ignore, but nothing specific yet. But we're certainly looking into options for continuing education without having meeting face-to-face in large group settings. Yes.
So I do want to give you a shout out if you haven't seen it. The ADA News that just came out this week has a very nice article about how much CDS has done to stand up to help the Illinois Medical District. And as you said, the significant contribution of the CDS members for helping our frontline medical providers, and they've been very, very appreciative. It's been an incredible opportunity for dentistry to be able to be a part of supporting the frontline workers. And we actually have some of our dentists actually doing the testing swabs right now. So
very good.
Kind of different.
Very good.
So I'm curious, what have you been hearing from members right now?
Yes, so it has been a roller coaster ride a little bit. What I've been hearing from members mostly over the last week, there's been a little bit of confusion, some mixed messages. People, of course, want to get back to work. On the other hand, there are all the questions about what are we to do when we get back to work. There have been some mixed messages coming out of the governor's office. A few days ago, we were told that we could have been working all the time. Then yesterday, that was changed back to emergencies only. So members are a little bit confused, some to a certain extent. I do want to say that yesterday there was an interim guide that came out from the ADA that I think was a very helpful tool that I will steer our members to as far as answering some questions about what to look towards when we return. But the biggest concern, I think, for our members, the questions that I've been getting is, are we allowed to be working yet? Are we allowed to be using our high-speed handpieces? People there, we've gotten so many sort of different messages, and people, the members are a little bit confused and concerned. And also the other thing is the procurement of the PPE. That's the next thing, because once we do get back to work, will we have enough of the PPE that we need to keep our patients safe, ourselves safe, our staff? So that's the other big issue.
Yeah, you touched on some big mega issues. I have been in communication with some of the large vendors, especially 3M, as to what their projection of the supply line is for the PPE that dentistry would need, and been in discussion with the governor as to what would be needed for releasing that. Right now, under the federal act that's in play by President Trump, many of the inventory for personal protective equipment is under federal edict right now. So until the federal government backs off, the vendors are actually saying they actually have quite a large volume of PPE, and are actually indicating that based on the supply chain, they feel that by midsummer there will be plenty of PPE, and in fact we then can get past some of this hoarding like toilet paper like activities that have been going on in some parts of the marketplace with basically exorbitant charges and classic supply and demand. But the major vendors are saying that the supply chain is getting better. It's going to just take some time. But
that's very good news.
They're very much very interested in helping, and they recognize specifically based on the OSHA statement from late March, which dentistry was placed at high risk because of the aerosolization that we inherently generate by ultrasonic and high-speed handpiece. But the vendors are recognizing it, and they're working very hard to help engineer solutions. Actually, I'm working with College of Engineering faculty here whose research area is in aerosols and viral transmission. So it's been very opportune for the conversations for them to understand what we deal with in dentistry, and they're coming up very rapidly with some very creative solutions. So in a time of crisis, you can come up with some really cool ideas that can get us back to playing the game that we all love to play.
Well, there is always a bright side to every story, and it's good news to hear what you're saying about the supply chain. My only concern about that is you mentioned midsummer, and so again, it brings up some concerns for those that are looking to getting back to work at the end of May, perhaps, or beginning of June. So I think these are still some issues that need to be worked out.
Sure. Well, part of it is when the federal government put into place the War Production Act from 1950, that act actually locked down inventory. So even though there was inventory that could be shipped, it's now under the War Production Act. So that's where some of the vendors saying, as soon as that act is lifted, they would be able to provide a rapid flow into the supply chain of authentic PPE. As you know, the market's being flooded right now by let's just call it cloned items that look real but aren't. So that's the concern right now. And 3M is extremely concerned about their reputation, so they're very sensitive about it.
Right.
The other thing that I just want to talk about is your thoughts around the CARES Act. Now, we went through what I call phase one of the Small Business Administration 2 loan programs. They ran on money. Just in the news this morning, we started in round 2 yesterday, I think. What have been the observations from the members over trying to get support from the 2 programs?
Yes, so the members that I've spoken to about that, many were having trouble. With the first round, they were having trouble receiving funds. With this second round, I'm hopeful that they will have better access. I know there are more banks and entities stepping up, offering access to these funds rather than the huge banks. I think that was part of the problem. And so I saw today there are some other avenues that you can take to receive the PPP loans. So I'm hopeful that our members that were not able to get funds through the loan the first time will be able to have access now. As far as the EIDL grants and those loans, also, it's been split. Some of our members have been able to get that first advance based on the number of their employees. There are others who have not received that money yet. So I'm not sure if that was based on how quickly they applied. I really don't know. And so some have gotten that money. But as far as the PPP loans, a lot of people are still waiting and we're not able to get in on that first round. I did see this morning also a few more of the large entities that received millions of dollars that didn't necessarily need it are giving back. And so I hope that that trickles down to help our members who were not able to get those loans yet to procure the money that they need.
Okay, fair enough. Is CDS doing anything to help members in guiding through a very complex situation of trying to apply for these loans? Or where do you see a role there for CDS to help just give information to the members on this?
Well, yes, and that's exactly, well, first of all, we've been very forthcoming with sending out any information that we've gotten to all of our members on via email or on our social networking devices, Facebook and such. So we've gotten any information that we've made available to our members. But that's exactly why we are hosting the webinar on Thursday. We wanted something specific to Illinois. We've been inundated with webinars, which is fine, but we wanted to provide something specific for our members in Illinois. And so the Chicago Dental Society decided to host this webinar specifically on HR issues, on business issues, on the PPP loans. So again, I already mentioned, but if you have not signed up, we do have a limit, but we still have spaces available. And I would urge people to sign up for this webinar. It is a question and answer format, and the host has asked for specific questions that they will address during this webinar on Thursday at 2 o'clock. And so that is exactly why we are hosting this, to help our members with these issues.
Excellent, excellent. Thank you for doing that.
Yeah.
Do you have any questions for me?
I do. When you asked some of the concerns that our members have, one of the recent sources of confusion have been, there was a mandate sent about a week or 10 days ago from the Illinois Department of Public Health regarding the fact that dentists were not to be using high-speed handpieces. And then as we discussed at the beginning, then we got some mixed messages from the governor. But now I would like some clarification so that I can give our members from IDPH regarding what they said about the use of high-speed handpieces and where we stand with that right now.
So we should be getting some guidance released either today or in the very near future. It's working through the standard processes of IDPH, but there has been a lot of communication with the governor's office. The idea in concept is, when we looked at the ADA toolkit that came out yesterday, I would say in terms of the conversations is now emulating very closely the same kind of recommendations of staged reentry. I like to refer to this pandemic as like landing an airplane in a thunderstorm. We're going to have ups and down drafts. We're going to have times when it's calm, and then it's going to get really violent. And it's a, if you ever landed in an airplane, you just, you're praying to the God of you want. And when you hit the ground, you thank him or her. And it was one of those things where I see right now that what they're trying to do is to risk looking at the various procedures we do as dentists, and then looking at the risk profiling of that, looking at the kind of level of either environmental controls that may be needed, or what we refer to as administrative controls. In a dental school, administrative controls would be, for instance, the standardized infection control procedures we have, and the standardized infection control training we do with faculty and staff and students. It's the same thing as in your private office, where you would have your standard operating procedures, making sure the cleaning equipment is there, making sure that, as with the ADA toolbox yesterday, it came out things like getting rid of those 20-year-old magazines that used to be sitting in the reception room.
We've all wanted a reason to get rid of those anyway.
Now they're gone. Reader's Digest won't be the same, but so it's one of those things that is changing. And I think one of the most important things here is we need to make sure our patients have the confidence that us as dental care providers are having their best interests in mind, which every member does, I'm sure. But we need to show that, so that they trust being able to come back and trust to be able to be in our practices, feeling comfortable, knowing that we are doing the very best. We have a lot of patients here who are calling us daily, going through all of the issues with emergencies. And we have to do that same standard process of triaging. I have excellent faculty who are actually triaging, doing teledentistry, assessing, is it an emergency, is it an urgency, or is it simply a time-sensitive issue and we need to stabilize that situation. And then all the way to elective. Now, I tend to try to avoid the use of elective, because what does that really mean? And so I tend to like to use the term time-sensitive procedures that we need to get our patients in. That may mean using a aerosol developing source, such as a high-speed handpiece. The mitigation there is obviously what we know right now is, for instance, there are a variety of different vacuum systems that everyone is looking at. That's one of the projects I'm working with engineering right now to evaluate the, I call them Hoover machines, to see if they really work, because there is no data. Every company that I've talked with, and we've ordered a couple of them to test at the school, they don't really have any performance data. They just have
Right.
manufacturing data, but that doesn't necessarily mean that they work. And so that's one of the things that we're looking at. We're also looking at least at the college, changing and adjusting the HVAC system, changing environmental controls in the building. And then we also built 5 negative pressure rooms, which currently turned out to be relatively straightforward to do. But I personally can't do 350 operatories into a negative pressure suite. It just is cost prohibitive. But we are looking at different strategies, and that's what it's going to take in the end, is mitigating this. It's going to take a range of different creative engineering strategies and administrative strategies. In our case, how we triage the patient, how we verify their health. Eventually, we are working with UI Health and the system here about the COVID testing. Are we going to get to a point such as was just introduced in one of the countries, actually a driver's license to indicate, so to speak, your antibody status? Although we don't know, even if you're antibody positive, if that is a protective titer or not. That's still an open question about the role of the passive immunity, and time will tell with that. The other thing that we're looking then through is so we have engineering controls, then we have administrative controls. Engineering is the most efficient and effective. Then there are administrative controls, such as how we're working and running our practices, how we're triaging our patients, how we're doing the standard informed consent, all of the things that were laid out very well in that ADA toolbox. And then last is PPE. So we talk about getting a fitted N95 mask. We talk about face shields, which is the two elements that are most important. We talk about the gowns. We talk about other types of equipment that we may need. But again, it's in the hierarchy of efficiency, the most efficient is that engineering control, then it's administrative, and last it's PPE. So it's really important as we're thinking about our practices and the workflow of the practices, we need to look carefully at mitigating at each of those steps. And not just relying on a mask and a shield. Because we have to be very careful and cogent about our patients and our staff and our fellow working colleagues. And that becomes an issue, especially when reputation of practices is going to be very important. We need to make sure our patients feel comfortable returning to our practices, feeling safe to be in our practices, and knowing that us as some of the best dental care providers in the world, we continue to have their best interests in mind. That's, I think, one of the most important things on the other end of this little episode that we need to work at as a profession.
Yeah, I couldn't agree more. I was contacted by a patient of mine yesterday, and she's a friend of mine, and she wanted to know, what was going on and when the office was reopening, because she wanted to get in for an appointment. And I explained to her that we would reopen as soon as I felt we had the necessary protocols in place and the necessary PPE. And she responded exactly what you touched upon. I trust you. I know that you would not do anything to put your patients in danger. And I will wait until she doesn't have any type of emergency situation going on. And she trusts that we would not reopen until we're ready to keep our patients safe and our staffs. And so I think what you said is so true and vitally important, that we have to make sure that we do everything we can to have all the proper protocol in place before we reopen our offices, and that might be different for each individual person. I know what I am looking towards, what will be comfortable for me. That might not be comfortable for the next person. And the other thing that I just want to say is I think the testing, if we could sort of procure rapid tests so that we could test the patients before they come into the office, that would be of great help. And so I think we all have, we're all on the same page in terms of we all want what's best for our patients, and we all want what's best for our profession. It's just, it's a process right now as to what the answer is to that.
It's a staged landing of the airplane. Yep.
Well,
So I want to thank you very much for taking time out of your day and spending with me. Hopefully the members of the CDS are a little bit more enlightened by the great leadership. You started off your year with the concept of a kaleidoscope. I have, it's interesting, I don't know if you meant it, but the kaleidoscope has become an interesting analogy about the way everything is spinning right now. But again, I want to thank you for your leadership, and congratulations again on being CDS president, because we need your leadership at this critical time.
well, thank you very much. I appreciate your time, and I appreciate the opportunity to talk to you. Thank you very much.
Thank you. Have a great day.
You too. Thank you, Dean Stanford.
Bye-bye.
Bye-bye. Bye-bye.